Well, it happens every 40 seconds, and it is one of the top 5 leading causes of death in the United States. It is an attack on the brain. We are talking about stroke, and tonight we will have experts from Mountain States Health Alliance right here in our studio to give us information that can save lives. To give us a preview, we have Dr. Chip Massey, a radiologist, and registered nurse Sam Turbyfill, both with MSMG Neuroendo Vascular Surgery. We want to welcome both of you to the show. Thanks so much for joining us this morning.
Thanks for having us.
Well, certainly just talking about those statistics, and I know those are numbers, you see faces, you see patients every day that deal with something like this.
Sure, yeah. So that brings it home. You know, we see them show up, and a lot of times we can make a big difference and get them out pretty quickly and normal.
Yeah, and one of the things that we hear about with stroke is that time is so crucial. Why is it so important to recognize the warning signs?
Well, if you have one of the warning signs of stroke, the term we use is FAST, which is face, arm, or speech abnormality that occurs suddenly. It's important to get to the hospital very quickly because there are some things we can do to kind of limit that damage or reverse it in some cases.
And Sam, talk to me a little bit about some of the things that patients will experience when they're having the signs of a stroke. What are some of the things that we should be looking for?
Well, just like Dr. Massey was just talking about, basically your symptoms are what we teach our patients with the FAST. Anytime you see someone who all of a sudden one side of their face is drooping, and that's something new that hasn't happened before. If we have an arm or a leg just on one side that's weak, and I was able to move it freely, and now I can't. That's our arm. And then speech, if suddenly we can't get any words out or suddenly it becomes very slurred, those are our 3 big warning signs that something bad is happening, and we need to look at the clock and we need to get to the hospital quickly. And we preach also that, not just for our grown-up people in our lives, but we need to teach our children those things too, because sometimes they're going to be the ones that spot that for us.
And when it comes to medical care, we're certainly seeing that technology and research makes such a difference. What are you guys seeing in the world of stroke? Are we coming a long way in how we're able to treat it and combat some of the symptoms?
Absolutely. We've, we can offer a clot-busting medication, so to speak, which is called TPA, if you get there within, say, 3 hours. But even if you're outside that 3-hour window, we can offer some other things such as endovascular retrieval of a clot, up to sometimes 12 hours to make a difference. So technology has really exploded on that front. The devices were able to advance to the brain and pull out clots if we need to, have really gotten much easier to use, much safer, and have made a big difference.
And of course, the number one thing is to try to prevent this.
Sure.
Are there some lifestyle things that we can be doing? Are there some things that make us more susceptible when it comes to stroke?
Sure. I mean, high blood pressure is obviously a problem with a big problem. Diabetes, it's uncontrolled, is a big one, and smoking is a big one. Those are probably the big 3.
Top 3.
Yeah. So we can change some of those lifestyle things. Are there some other things that we're sort of born with that unfortunately?
Yes, it's there's a genetic predisposition to this condition. So I would say that anybody, if you have a family history of stroke, then you probably need to get screened, and we can evaluate your blood vessels and see where you are as far as a risk factor for stroke, and then we can prevent some of those things before they occur.
And Sam, you were telling me about the center and where you guys work and sort of your approach to treating stroke patients, because it seems like it's like a team that has to come through.
Absolutely, and the stroke team is all over the hospital. As soon as their stroke pagers go off, they know that they're alerted that something is coming into the hospital. The people in our CT department, our ER department, our stroke coordinator, our neurology team, everybody is on the standby, everybody's ready to go, because we want them there, we want them to be seen quickly, we want to evaluate it quickly so we can take care of our patients the best we can.
And it seems like raising awareness of this is so important, and that's why we're having this special program tonight, and we're urging people that if you have a question, to call that question, and we're actually going to have people that are standing by to take those questions, and then we'll be asking it to you guys who can answer that. But you were saying raising awareness, getting that word out, especially this time of year, is so important.
Absolutely.
Going to have a lot of family in, so we want to make sure that we know those acronyms
Yeah,
and
absolutely.
we know what
Fast.
to look for. Absolutely. Well, thank you guys both so much for joining us, and we'll
Thank
see you
you.
again this
Yay.
evening.
Okay.
We'll be
sounds
here.
good.
We want to give everybody a phone number. If you already know of a question, go ahead and call that. Somebody will take your question at this point, and we'll go ahead and put that on a notebook, and we'll ask that question coming up this evening. But we hope you'll join us tonight at 7 o'clock right here on News Channel 11. There is that 1-888-903-9545 if you have a question.